Hello, my name is Nurse Pauline RN. Welcome to my channel. I have completed Exam 2, Part 2, Part 3, Part 4. Please check my playlist. Today I'm doing Fundamentals of Nursing, Exam 2, and we are now on Part 5, Questions and Answers. Before I get started, please hit the like button. Please subscribe to my channel if you have not subscribed. And please share my video. Today, let's talk about gloves. When do we use non-sterile gloves? We use non-sterile gloves before you go to the patient's bed. You always wash your hands, then you apply your gloves. You must always have your gloves on, even if you pick up something from a chair or you pick up something on the side and hand it to the patient. You have to use your gloves in order to hold whatever the patient wants you to bring to him or her and present it to the patient. So long as you get to the bedside, always use gloves. So long as your hands are over the side rails, always use gloves, because the rails are dirty also. When you hold the patient's side rails without gloves, that is transferring bacteria from the side rails to your patients. So you always wash your hands before you put on your gloves. Put your gloves on before and after taking care of your patients. When your patient is admitted to the hospital, the patient tells you that he or she is allergic to latex. What do? Patients with latex allergy can develop anaphylactic reaction. You have to give them that allergy bracelet. You have to document it in their allergies. On admission, make sure it's on the patient's EMR, electronic medical record for EMR. You have to make sure there's a sign on the door for anybody entering the room. Physical therapist, occupational therapist, the doctor, the speech therapist, the families. That sign must always be at the door that this patient is latex allergy. The patient, the nurses, and everyone uses latex-free gloves, not your regular gloves. Latex-free gloves. So you set up a supply at the patient's bedside or on the outside of the door with all the things that the patients will need that are latex-free. Latex-free Foley catheters. Do not insert a regular Foley catheter into your patients, because your patient will develop anaphylactic reaction. So there must be a sign on the door. And handoff communication means when you hand off your patients to the night nurse, in this handoff communication to the night nurse, make sure the night nurse is aware that your patient is allergic to latex. When your patients are having difficulty swallowing, you're feeding the patient and they're choking and they're unable to swallow, what do? You notify the doctor, stop. Do not continue to feed this patient, because this patient is at risk for pneumonia aspiration. The food will get into the patient's lungs. Stop. place an NPO sign on the door over the patient's bed. Do not feed the patient anymore. Communicate to the doctor. The doctor will order a swallow evaluation to be done. A swallow evaluation is done by a speech therapist who will come to the bedside and do a swallow evaluation on your patients. The speech therapist may say, well, this patient, you should not continue feeding this patient anymore. This patient is NPO. Or the speech therapist may say, instead of feeding this patient with a regular diet, why don't we try a puree diet or a soft diet? If the patient is not tolerating it, the patient should be NPO. But a speech therapist does speech evaluation. Some patients, if they're drinking water, you can put a thickener, like a gel, in the water to slightly thicken it so the patients can swallow that water with the thickener. But if the speech therapist says that's not recommended, do not give the patient any water with or without the thickener. Maybe your patients will be on IV fluids to keep your patients hydrated. What is PPE? PPE stands for personal protective equipment. PPE. These are your gloves, your gowns, your mask, your goggles, your face shields. These are your PPEs. Latex allergy, signs and symptoms, reactions are anaphylactic reaction. Your patient will break out in hives, swelling, runny nose, sneezing, difficulty breathing, swollen tongue. Patient will become short of breath. Patient will have difficulty breathing. This is an emergency at this point. You will have to call a doctor immediately, or you will have to call the meds team. Patient is developing a serious life-threatening emergency. That's why all the personal equipment has to be latex-free. Gloves should be latex-free. Foley catheters latex-free for all patients who are allergic to latex. When we say non-sterile procedures, non-sterile procedures are non-sterile procedures. Examples are when you're handling your patient's belongings, when you are non-sterile gloves. Okay. Non-sterile gloves are used for non-sterile procedures. Sterile gloves are used for sterile procedures. These are your central lines. You're inserting that your patient cannot get a regular IV because he or she doesn't have a vein. Some patients' veins are too small. They keep losing their regular IVs, so the doctor gives an order to insert a central line so they can get their IVs, their antibiotics, their parenteral liquid nutrition, feeding if they need it. So for sterile gloves, we need to use that for patients doing surgeries. Doctors use that in surgeries, the OR team, surgical procedures, dressing change. They use sterile gloves in hemodialysis. The nurses use sterile gloves in hemodialysis. We use sterile gloves when the doctor is inserting a chest tube. the doctor uses a sterile gloves. Okay, your patient has a chest tube. What do you do when your patient pulls the chest tube out? The patient rings the bell and says, "Nurse, my chest tube came out." What do you do? By accident? This is an emergency. Call the doctor stat. Let someone else call the doctor. But you stay with the doctor. You stay with the patient. I'm sorry. You will use an occlusive dressing, a sterile dressing with sterile water, and cover the chest tube site, incision site, until the doctor comes to the room. That incision site where the chest tube was inserted, do not leave it open to air. So while you're waiting on the doctor, immediately cover it with gauze, sterile gloves, sterile water, and you cover that insertion site until the doctor gets to the room to prevent air from getting through. You'll stay with the doctor. If the patient is having shortness of breath or difficulty breathing, the doctor do not get there in time, call the meds team. It's an emergency. Do not let air into the insertion site. Do you know what are the reasons why the doctors would order a chest tube? The doctor would order a chest tube for lung collapse, for lung infections, for bleeding in the lungs. This is a sterile procedure, insertion of a chest tube. Some people have chest traumas in motor vehicle accidents. The doctor has to insert a chest tube to drain all those bleeding, and so you call your doctor. This is an emergency. A chest tube, do you know what it's used for? A chest tube is used for removing air, removing fluid, removing blood, removing pus. This is a sterile procedure, and the chest tube moves air, fluid, blood, and pus. And the tube is connected to a drainage canister, and the nurses will measure output on this canister and document it every 4 hours. The output have to be documented. When a patient has a chest tube in, it has to have an occlusive dressing to prevent air from escaping, to prevent air from going in. What the nurse does is assess the chest tube for intactness. You will assess the chest tube site to make sure the occlusive dressing is intact. Make sure your dressing is maintained. You are assessing the chest tube site for air leaks, for crepitus, air leaks. If there are any crepitus, notify the doctor. If the dressing is loosening up, add more tape, more dressing to it. It has to be taped tightly to prevent air from going in and out. If your chest tube comes out, what do you do? If your chest tube comes out, It's an emergency. What you do, you apply pressure to the site, wait for the doctor to come, send someone else to call the doctor. You put your sterile water, call the doctor. If you stay with the patient, never ever leave your patient if the chest tube comes out. If your patient is experiencing any difficulty breathing or respiratory distress, short of breath, oxygen, pulse oxys going down into the 80s, this is an emergency. You call the meds team. When the chest tube comes out of the side, the end of the chest tube should be placed in a cup with sterile water until the doctor gets to the room. The chest tube, do you know where the chest tube is inserted? A chest tube is inserted in the 4th, the 5th, the 6th intercostal spaces. Anterior axillary line. The chest tube insertion site is in the 4th, 5th, 6th intercostal space, anterior axillary line. Please hit the like button. Please share my videos, please. And please subscribe to my channel. Thank you. Have a blessed day. This is the end of part 5, and I only have 5 parts to exam 2. Stay blessed. Make sure you know everything for exam 1 and exam 2. If you can pass exam 1 and exam 2, I know you can pass fundamentals. But these are the 2 exams that are a little bit, you gotta study a lot for these 2 exams. Have a blessed day. Take care. Stay blessed.